second. Okay, this is lecture 8 before the break for the Introduction to Medical Interpretation 1 course. And we're also broadcasting live a seminar on medical terminology. So those of you who are here taking this course are also joined by people that are some interested in students who would like to also participate in this session. And they are participating live from now until the end of this whole session. Even though the session is only on medical terminology, I intend to do medical terminology, roots, medical roots, and so on and so forth, and then put a practice, a consecutive practice, and then that's how we're going to end. We're going to be ending the lecture 8 before the break for the students who are here in class. Then we will have our break, and I will answer any questions regarding those practices, or that practice, that consecutive practice. And at that time, I will continue with the lecture, and then those of you who join live, that will be the end of it. Once I finish with the medical terminology and I play the consecutive that I will play at the end of this session, that will be the end. In other words, when we go on a break, then after that, those of you who are on live attending this medical seminar terminology, medical terminology seminar, will not be able to see the second part of this class, which is lecture 8 after the break. And of course, registered students who are online will be able to access it as usual. But today we would like to talk about, first we want to look at medical tools, roots. And the reason why we want to look at medical roots is because sometimes when you take the written medical exam, you are unable to understand what is the meaning of a given word, and if they ask you for synonyms for that particular word, you need to, if you don't know the meaning of that word, at least you can determine what it refers to based on those roots. And that way you can have an idea of whether it refers to the heart or to the kidney, or if it refers to the skin, or if it refers to the joints, or whatever the case is, and then look at the options and determine which one is the best synonym for that particular word. So we want to discuss medical roots first, and then the second part where we will be discussing medical terminology, we are not going to be discussing advanced medical terminology or high register. We're going to be discussing medical terminology at a low register. In other words, we're going to be talking about colloquialisms that are so important from Spanish into English. Many of these things that we will be discussing, you can't really find them anywhere because they're very region-specific colloquialisms. So let's begin with essential roots first. What exactly is, how could you actually use these roots? Let's say, for example, that they give you a word, and I'm going to use a word I can use it in English, or I can use it let's use it in English, arthritis. Okay, so, and we all know what it is, but let's say that you don't know. Well, if you don't know what it means, this root, A-R-T-H, refers to joint, the joint in the body. And I-T-I-S refers to inflammation. Okay, so what this means is inflammation of the joints. And that's the reason why we would like to do this type of, include this in the lecture, because sometimes you don't know the term. Obviously, we know what arthritis is, but sometimes we don't know the term, and we can figure out what it really means by looking at the roots, and it's unique to medical. And we will see some terms in Spanish as well as in English. It really doesn't matter. The roots are the same. They mainly come from Latin. So it's not really, there's no difference whatsoever. Usually if it ends with omia in Spanish, it will end in English with O-M-Y. Okay, so there are many very, very basic differences. So we're going to mix it in both languages. But before we even do that, I'd like to discuss some roots or I'd like to give you some examples. Excuse me. I'd like to give you some examples of. Just leave this book here. I'd like to give you some examples of some of these roots that we're talking about and how they are actually used. Okay, so let's look, for example, at this one, for example, cystitis, which is in Spanish. In English is pretty similar to that as well. What exactly is that? Well, when you look at it, when you look at that particular word, the word cystitis, it's actually, it has a root, it has different roots, and the basically what we have is that cysto in Spanish, or in English, it doesn't matter, refers to bladder. And of course, itis refers to inflammation. So basically what we have here is an inflammation of the bladder. That's what it refers to when we look at the word cystitis or cystitis. It's the same in English. This word in Spanish, for example, adenoma. What exactly is that? Well, this root aden refers to a gland or una glándula. And this oma always refers to a tumor. So it's a tumor in the gland. That's what it means, okay? For example, look at this one. That's also in Spanish. Adenectomia. You could say adenectomy. Adenectomy is the same in English with a Y. Just substitute the IA and put a Y. The roots are the same regardless of what language you use, because these are words that come basically from these roots. So when you look at this expression, aden refers to a gland. Ectomia, and I missed a C here, ectomia, refers to removal. Okay, so basically adenectomia is the removal of a gland. Adenectomia or adenectomy is the removal of a gland. Let's see, for example, this one. Hyperglycemia. Hyperglycemia. What exactly is that? Well, everything that starts with the root hyper means more. And like this means sweet. And emia or emia refers to the blood. So what it means is there's more sweet, more glucose in the blood. That's what it refers to. Hyper, more, glyce, sweet, emia or emia, blood. Okay? That's important to keep in mind. Look at this one, for example. Hysterectomy or hysterectomia. What exactly would that be? Well, if you think about it, hyster, this part refers to the uterus, the womb, the matrix. And what is the meaning of octomy or octomia, as we saw it already? Ectomia or octomia. Hysterectomia. That will be removal. So hysterectomy is the removal of the uterus. Okay? Now, these are just examples. What about this one? Let's see. Cardiomegaly or megalia. You could also see it like this. Cardiomegalia. What does this refer to? Well, anything has to do with cardio, we already know that, most likely, refers to the heart. And megalia is when it is it's exaggerated in size, right? It's enlarged in English. So cardiomegalia or cardiomegaly or cardiomegalia in English is known as an enlargement of the heart. It refers to. So this is just an example. I'm going to give you some of these roots, particularly the roots that come out at the beginning, these ones here, because at the end you could always see ectomy or itis, and these are all pretty common. So ectomy is removal at the end, itis is inflammation, megalia is enlargement. So if you have, for example, so to simplify it, a word that ends with itis, this means inflammation. And inflammation of whatever that word is. A word that ends with ectomy, as we had in the example here earlier, it always means, this ending means removal, extirpación in Spanish. And if the other one is megalia, or megalia is enlargement. If it ends like that, that's enlargement. Okay, now what we're going to do is a series of roots that go in this location, because those are the ones that change the most, okay? So I'm going to discuss them with you in a second. So I'll give you some time to write this down. Okay, and the use of this particular roots is just strictly for the written component of your exam, to have a better idea of what is the meaning of a given word, or the options if they ask. Let's say they give you a word and in a medical term, and they ask you what that word refers to. In what type of system would you find that word, or in what type of special doctor deals with that particular word, or whatever the case is. It's basically you need to identify what the word means. And if you don't know the word because it's too high of a register, using these roots will certainly help you. Remember the endings, and now we're going to look at the first, the prefixes, okay, and see how that works. Let's look at some of those. When the word starts with aden, whatever comes after that, this means gland. If it starts with arrow, it means air. If it starts with angio, it refers to, this really refers, it could refer to two things. It could refer to vessels, and usually that's what it talks about. Angiogramma, for example, right? Anything that starts with angio has to do with the vessel. It's more like the health of the vessels, okay? And that's important to keep in mind. Art in Spanish, in English, you may see it with an H. This refers to joint. Okay. If the word starts with cardio, we already know what that is. It refers to heart. Okay. If the word starts with cephal, in Spanish, it's like this. English might be like this. This refers to the head. Spanish, for example, cefalea refers to the head, dolor de cabeza, right? If it starts with cervi, C-E-R-V-I, then it refers to the neck. The same thing if it's cervico. In Spanish is common. In English, you will see it only in this direction, in this one here. In Spanish, you can see cervi, like cervicales, or cervico as also as another potential prefix. What about this one? Costo, which in both languages applies, that refers to rib, or costilla, no? Cysto, we talked about that a little bit earlier, that refers to bladder. It can also refer to gallbladder. It could also refer to, but in general, it refers to bladder. So we put also gallbladder as a second option. And if you notice that bladder doesn't make sense based on the answers or the options that you're given for that particular word, check gallbladder and see whether that actually works for you. Cito refers, this prefix refers to cell. Okay, the cells in the body. Dacryo, something else. This refers to tear. The tear from your eyes, right? That's what it refers to. It has to do with, sometimes there are some conditions where your body produces tears nonstop. So it has to do with that as well. But it has to do specifically that prefix has to do with the eye. Okay, dactyl. This refers to the finger. Dactiloscopía, right? And huellas dactilares, for example, refers to the fingers. Okay, derm or dermato, both of them refer to the same thing, and that is what? The skin. Dermatitis, if we look at that, or dermatitis. Derm, skin. Itis, inflammation, inflammation of the skin. Okay. Enter or entero. In both languages, you use either one. This too corresponds to intestines. Gastro. Gastro refers to what? The stomach. We talk about this one, gluco or glico. Both of them refers to sweet, something that is sweet, sugar. Glucosa, for example, right? Has to do with reemplazante de azúcar. Hemat refers, or sometimes in Spanish we also see hemato, and in English as well, hematology, for example. Then this translates as blood, refers to blood. Okay, that's a B as in boy. Hepat as a prefix refers to liver. We look at this one already. Hyster, like hysterectomy, it refers to uterus. Okay, the womb, the matrix, basically. Leuc, which is L-E-U-C or L-U-C-O. These two refer to white cells. Actually white. That's leukocyto is white cell, right? Because cyto refers, as we saw earlier, to cell. So if I say leukocyto is a white cell. These are prefixes, and sometimes they're also used as the ending ones. So these are important to know, plus the three ones that I mentioned earlier, which is ETs and all the let's see, they're here, ETs, ectomy, these are important, and megalia, these are important ones as well. Let's see a few more here. Lip, well, just one more. Lipo, this refers to fat. Grasa. So this is sort of on the side. It's not the intent of this is, I mean, even though it's medical terminology, I wanted to give you at least some roots because the roots are important, and I strongly suggest that if you are preparing to take the written portion of a medical exam, either the national, the board, or the one, the CCHI, you should really review some of these roots and additional roots that you can really find anywhere in any book or even online. There are medical roots and medical endings, and you should review them because it's going to help you determine what is the meaning of a given word. And even if you don't understand the meaning of the word, at least it's going to give you an idea what it corresponds to. So when you're given 4 options, you are much better informed to select which one is closest in meaning. Or the opposite, if it's an antonym, it will be the one that is not close in meaning at all. Now let's talk about colloquialisms, and colloquialisms are important. The reason why they are important is because that's the way people talk. And one of the major things that we have to keep in mind is that in Latin America and in the US, we have a problem with body parts in terms of how we describe them. In Latin America, we do have a different name for a body part if the body part belongs to an animal. And if it belongs to a person, we have a different name as well. So the key, of course, is to make sure that when you hear it in English, you produce or you transfer into Spanish accordingly. In other words, if you hear the word, for example, leg, you will say pierna. You wouldn't say anything else. Or if you hear back, you will see espalda, say espalda for a person, and you will probably say lomo de un animal. If there are so many feet, for example, you say pies for a person, patas for an animal. There are so many examples of this. Even hair, cabello, and pelo is different between a person or an animal. So that's a problem, because when we hear the word in Spanish, then we know that what the word is. If I hear lomo, I don't have any slang in English necessary to denote that, so we just basically say back. Me duele el lomo. If you hear something like that, then you will say my back hurts. Basically, what I'm trying to say is that the register cannot be met here, the rules regarding register. If you use a lower register in one language, in Spanish, you may not have an equivalent register in English for it when it refers to a body part. In fact, for many of these colloquialisms, you will find that the register doesn't match generally. And that's the nature of colloquialisms in the medical field. You hear them at one level, very low register by definition, because they are colloquialisms, and you really use a more general term in English, because very often there is no equivalent term. So we're going to see some of those right now, and we're going to start, for example, with the word aborto in Spanish. You're going to see this in Spanish into English, because that's how you're going to hear it generally. The colloquialism comes from Spanish into English. When we say, for example, ella abortó, it doesn't mean that you have like a miscarriage. The meaning is more like this is an induced abortion. Now, if it says, for example, un aborto espontáneo, then that's a different thing. That's a miscarriage. So, just the same word, when you just speak only aborto, like in this case, and if you don't say espontáneo, then it makes it automatically an induced abortion. Okay? If you just simply say abortion by itself, it's most likely will be clearly understood that you're talking about an induced abortion. So there's no need to say it. But it's more obvious, the word aborto in Spanish, what it means, than the word just abortion in English. This is it's much more obvious. When you say aborto in Spanish, it's automatically that it was induced. When you say abortion, it could be a spontaneous abortion type of thing, or a miscarriage. So you can use abortion just for aborto, and that will work. Just to be on the safe side, if you say induced abortion, is better. Now, what about this one? Hace días. That is heartburn. And what it means is that this is the way we know it properly is acidez, right? This is acidez. But this is, for example, ando con hace días en el estómago. I have heartburn. Okay, so that's important. Agruras is also used for heartburn. Let me just put it here. That's another. These are the same. Agruras. That also means heartburn. Alambrito. That is an IUD. It's a method it's a birth control method, intrauterine device. Okay, IUD. Okay. Alferecia is epilepsy. And how is it used in Spanish? Mi niño tiene alferecia o padece de alferecia. He has epilepsy. Okay. What about this one? Aliviarse. Here's a term that in a given country means one thing. In most Latin American countries, it means something else. So depending where that person that you're interpreting for comes from, the message might be different. If I say, if there is somebody who comes from South America and says, "Me alivié hace 3 semanas," the expectation is that there is some type of you got some type of relief of something that was bothering you. Me alivié del dolor, por ejemplo, right? If even sometimes you don't even say del dolor. Mire, doctor, yo me alivié hace 3 semanas, and if it's a female and the person comes from Mexico, aliviarse doesn't mean that. It means to give birth. So you have a situation where you need to determine where the person comes from, so to actually understand clearly what they are referring to. Usually aliviar is accompanied by the word dolor. Me alivié de ese dolor. If you just don't have the word dolor, then it's automatically assumed to give birth, basically. Almorragias, almareos is dizziness. And almorragia, which is the same thing as almorranas, this too means hemorrhoids. Okay. Pardon. Almorranas is hemorrhoid. Almorragia, this one, so I'm going to eliminate this. It doesn't mean that. So almorragia has to do, there's a mistake here in my notes. Almorragia, it is not hemorrhoids, it's hemorrhage. Too much bleeding. So almorranas, hemorrhoids. And if there is too much bleeding, almorragia will be the term that they use for that. Amodorrado is drowsy. Sometimes they say, for example, ando malito, doctor. I mean, I feel bad. I'm not feeling well. That's what it really means. So that's another one. Andar malito. Not to feel well or not feeling well. Not feeling well. Okay. Barbilla, it's chin, which in correct Spanish or in a regular Spanish is known as mentón. The proper way of saying this in Spanish is mentón. Okay. Barbilla has the, barbilla or barba. Okay. They refer to chin. Okay. All right. So that's important. Okay. Let's see where we want to do this one. Blanquillo. Have you heard this one? This is common. This refers to a home remedy, and it refers to what is known in English as egg white as a home remedy. Okay, it's pretty common. Let's see. Boquinete. That is a cleft palate, which in Spanish we call it paladar leporino or labio leporino. It's also known as hair lip. It's pretty much the same. Boquinete refers more like a cleft palate, paladar leporino, but you could also use hair lip for that one, que es labio leporino. Okay. Cachetes. It could be the cheeks, or it could be the buttocks. It depends on context. Okay. Obviously, if the context will tell you whether you should use one or the other. Calores, hot flashes. Hot flashes. Cambio de vida. This one, there is an equivalent term in English which is exactly the same thing. Change of life which really means menopause. That's what it refers to. Canicas, which it could be marbles, of course, but in the medical thing, it also means brain. It's to do with the brain. So when you talk about canicas, I don't know if you're talking about marbles, or you're talking about the brain generally. In the medical field, will probably be the brain, obviously. Cerebro. This is not. It's very common that people will say, "Me duele mucho el cerebro, doctor." Okay, well, you can't really say in English, "My brain hurts." It's just a little bit too strong, right? It really means the head. My head hurts. But generally, it refers to, many people use cerebro when it refers more like the back of a head. You know, what is known as the nape of the head. The back portion of the head, okay? But just use head is good enough. It's better, actually, because you're more general. If you says, "Me duele el cerebro," my head hurts. If they ask you, where does it hurt, then the person is going to point in the back or whatever, and that will take care of it. But if you say, if you transfer it as the back of the head, then you commit to the back of the head only. See, the nape of the head is part of the head, but if you say the head, it's good enough, actually, because it covers that part. And it could be both. That's the problem, because when they say "me duele el cerebro," in some regions they refer to the whole head, and in other regions they refer only to the back. So it becomes much more complex for us interpreters to figure out, which one, what are you referring to. So by saying "my head hurts," then the doctor, if he wants to know more about it, will say, well, where exactly does it hurt? And then that will be clarified. Cintura. It's actually the lower back as a slang. But in proper Spanish, it's the waist area. So it's not uncommon for people to say, "me duele mucho la cintura." And when you say "me duele mucho la cintura," what is it referred to? Well, if they're using it as a slang, it means my lower back hurts. But if you are not using it as a slang, if they are using the word cintura in a more general terms, it refers to the waist area. Sometimes this is complicated. It's the waist and the lower back are close enough. And some interpreters prefer to transfer the word cintura as the waist area. I feel pain in my waist area, because the lower back is in the waist area, so to speak. But generally, people that use the word cintura are really referring to lower back, que es en español, in proper Spanish, this is la región lumbar, o zona lumbar. Okay. What about this one? Cruda. Hangover. Cuajo. Sometimes they also use cuajarón. Let me see. Or cuajarón. They both mean blood clot. C-L-O-T. Cuero. Skin. Interesting story about this word. There was a company, an airline company called Braniff out of Texas many years ago, and they flew to Latin America, and they were the first airline that actually had leather seats. So they have an advertising campaign in the United States that it was a big ads that said "fly on leather." That was in big letters, "fly on leather," which makes there's no problem in English. But when they transfer that into Spanish, they transfer it linguistically, and it sounded the same ad campaign in Latin America. After spending so much money, they have to actually stop the campaign, obviously, because the ad on top, it says "viaje en cuero," and that means travel naked. So it was not a good, let's put it this way, it was not a good advertising campaign for this company, and they wasted, I read that about $4.5 million in this, simply because they didn't want to pay $15 to a professional translator to actually determine that "fly on leather," you can't really say "viaje en cuero." They probably got somebody who doesn't didn't have a good understanding of the Spanish language, and particularly colloquialisms. Okay, so this one, chochero. Chochero refers to a medicine man. It's somebody that un chochero da siempre yuyos, which in English are known as herbs. Similar to a homeopathist, it's somebody a doctor who prescribes different type of herbs to cure different symptoms or to relieve certain symptoms. Okay. There's one particular type of pain, dolor quelante, that is very odd, but this means piercing pain. And I say it's odd because sometimes people use it, but a piercing pain is more like un dolor constante, no quelante. Sometimes people say, well, doctor, tengo un dolor muy quelante en la rabadilla, for example. By the way, how do you say rabadilla? Tailbone. Tengo un dolor tengo un dolor quelante en la rabadilla. I have a piercing pain in my tailbone. Okay, and what does it mean, piercing pain? It's like stabbing pain, huh? So that's another way to say it, which we know that stabbing pain is dolor. As a slang could be dolor picante, and dolor punzante with an N is what is the proper translation for stabbing pain. So let's just look at this. If you see stabbing pain, the proper way of saying is dolor punzante. But there are different slangs like dolor quelante, dolor picante. Both of them refer exactly the same things to the same term, stabbing pain. An interesting question that I have. If the patient is using colloquialisms, should you, as the interpreter, when you're interpreting from English into Spanish, use colloquialisms for the patient? This is sort of a gray area. It's up to you, but most likely if the patient is using colloquialisms, the patient will feel more comfortable and understand the interpreter better if the interpreter is using the same colloquialisms. So although we shouldn't automatically use a colloquialism, you know, like they say, do you feel any stabbing pain? And they say, ¿siente usted un dolor quelante? Or, no, you don't want to say that. You want to say un dolor punzante for a stabbing pain, okay? So when you hear in English, when you put it into Spanish, you don't use colloquialisms. Never. You use the proper term. But if the patient is using colloquialisms and it's clear to you, the interpreter, that the patient feels more comfortable with colloquialisms, it is okay to use colloquialisms from English into Spanish. So in order to establish better communication between the patient and the doctor. Because the whole point is about communication that flows. And if the patient feels more comfortable with colloquialisms, so that's fine. This is not like court interpreting where you have to keep the register. Our goal is to make sure that the patient understands the doctor and the doctor understands the patient. And also that the patient is comfortable enough to disclose or to tell the doctor what the symptoms are. Because sometimes if it is vocabulary, if you use vocabulary that is too complex, then the patient doesn't understand and doesn't even answer the question well enough, or may answer it without understanding it. So it's important that you determine what is the level of the patient so that you can communicate at that level instead of trying to, because after all, we may be dealing with a doctor who has been gone through university for several years and read many, many books, with a patient who has not even attended elementary school. So the doctor may be using terms that are not at the level of the patient. So we, as conduits between these two individuals that speak two different languages, we need to make sure that the understanding exists in the medical setting, not in the legal though, but in the medical setting. That's the rule. So we lower the register. We use terms that are much more accessible to the patient. So one of the things that a medical interpreter has to do is to determine in the first, minute or so, and it really doesn't take that long, to determine what type of vocabulary that patient is comfortable with. Sometimes they use terms that are in English. You know, they know certain parts of the body in English, they don't know it in Spanish. Sometimes they use terms, they mix languages. Well, whatever the case is, you don't want to mix languages, obviously. But if they do use colloquialisms, it is okay to use them only if they use it first, okay? Now, let's continue with a few more. We'll have a lot more, actually. What about if I say enfermedad secreta? Enfermedad secreta. This is a pretty, that way of referring to this disease, which, of course, we know that it means venereal disease. That expression here has a lot of cultural in it, because what it really means in English is a secret disease. That's what it would mean. But it's secret or it's taboo in our culture, but it may not be in the US. So the cross-cultural difference can be clearly seen here by looking at the original, the colloquialism, and the term in English. They're so different. You know, that one is more like secret. I don't want to talk about this with anybody. I don't want people to know. And that cross-cultural difference is very important in the medical setting. We don't only interpret words. We also try to understand or transfer cultural aspects of the individual, or both individuals, as a matter of fact. Okay, so that's important to keep in mind as well. Whenever you're doing an interpretation, you're sort of trying to, or you have to make an effort to convey the cultural difference in a way so that it's more clear to the person receiving the message. If you were to transfer, for example, enfermedad secreta as a secret disease, the doctor will not understand. So that's why, because you're making sure that the parties understand, that's why we're having this class, basically, so that you don't take each colloquialism and transfer it into English word for word, because they may not make any sense whatsoever. Okay, if you do that, most of the time it doesn't make any sense. Now, if it's a single word, sometimes it makes sense, sometimes it doesn't, but generally, colloquialisms don't transfer word for word, okay? So, for example, hacer de las aguas. At no time we have the word water here. It really means to urinate. So if your interpretation, if you're pretty obsessed about only transferring each individual word without actually looking at the whole message, then your interpretation will be pretty weak, because there's nothing about water here. Pass water, you can say. Maybe in English you can do that, but you have to use pass, okay? And that's fine. You can do that as well, but you got to use the proper verb in English. So these are the cross-cultural differences. In one language we make, and in the other one is to pass. So it's different. Okay, so we need to be aware of that. Hervor de sangre, for example, the word blood is here, sangre, and hervor has this connotation of, like a very hot flash that you get, that your body feels, un hervor. But how could it, or that it boils up? How could your blood boils up? It sounds more like you're very upset. But in the medical setting, this doesn't mean that. It means allergies, or an allergic reaction, actually. Si mi hijo tuvo un hervor de sangre, doesn't mean that he's pissed off. It means that he had an allergic reaction, okay? Okay. Let's see. Okay. Labio cucho, hair lip. Labio cucho is hair lip. Magulladura. That's a bruise. Okay. Mal de orina. That is a urinary tract infection, UTI. Urinary tract infection. Mala cama. That's the slang for miscarriage. Miscarriage. Mala cama. What about this one? No alcanzar resuello. This is a common one. It really means to run out of, to be short of breath, actually. Okay? It's not that you're trying to catch up to someone or reach something because of the word alcanzar, right? We are not trying to do that. Nuez de Adán, look at this one, for example. Nuez de Adán. Well, in English, it's Adam's apple. Okay, and you certainly, if you translate nuez into English, it could definitely be misconstrued. Okay? The other one, orzuelo del ojo. Sty. In the eye, okay. Sty is good enough. Pantorrilla. It's a calf. There are various ways that you can refer to calf. Generally, pantorrilla is the most common one, okay? Dice pegajoso. That means contagious. In fact, there is an expression that is very common in Spanish. It says, me pegó la gripa. You know, so he gave me the flu. It's like saying, I got, you know, the flu was contagious and I got it. That's what it really means. So me pegó doesn't mean hit in this case. It comes from pegajoso in the medical matter, which means contagious. So when I say me pegó la gripa, it means I got the flu from him. Okay, or he passed me the flu, or he gave me the flu. Okay, and it has to do with this idea of being contagious. Okay, that's important to also keep in mind. Piocha is also chin. In fact, there is a word, which of course chin in Spanish is mentone. There's a word that every time that I explain it in class, people don't know what it is and where it comes from. Piochita. That's a goatee. It's that beard that, you know, like la barba de candado that we call in Spanish. And that's what it refers to. It comes from the word piocha. Okay, piochita. Okay, rabadilla, we already talked about this one, but I'm trying to give you these terms in alphabetical order. This is tailbone. El Coxs, the Coxs. El Coxs es de la rabadilla. Okay. Retorcijones. Retorcijones refers to abdominal cramp. It's plural in this case. Another one here that is really difficult. Está roto. When you say, for example, estoy roto, doctora, it doesn't mean that I'm broken. It refers specifically to have a hernia. So I have a hernia, estoy roto. That's what it means. Lots of terms. Taba, kneecap, la cápsula de la rodilla. Taba, if you hear that, that's what it means. Abdominal cramp, which is retorcijones, it has another slang for it, torzón. That also means abdominal cramp. So, tengo un torzón muy grande, doctora. I have a very bad abdominal cramp. And we're almost done with this terminology here. Ventanillas, nostrils. Nostrils, with plural, yes. So, oh, and there's one I forgot here. Trippa comes from an animal. It's basically intestines. But it could also be catheter. A veces dicen, oh, me van a meter esa tripa. Really, catheter, okay? But if it says me duelen las tripas, it refers to intestine. And one more, since we are, suero is IV, and it's not necessarily a slang. Oh, and just, okay, one more here. Soltura is diarrhea. Okay, diarrhea, soltura. Okay. Basically, this ends all the vocabulary that has to do with medical terminology at a low register, and also some of the roots in the medical field. What we like to do next is I will play consecutive right now, and once the consecutive is over, we're going to finish with this lecture, which is lecture 8 before the break, and after the break, I'll answer any questions. And for those of you who are attending live, once we finish with this consecutive that I'm going to be playing, then you will be disconnected, so to speak, when we take a break, and you won't be able to access lecture 8B because that is not part of this seminar. This seminar is only on medical terminology. So let's do a consecutive where you hear the original, the question, and then you interpret into Spanish, and then you hear the answer in Spanish, and you interpret that back into English, okay? The consecutive will begin in about 20 seconds, all right? Here we go.
Good morning, Mr. Ramirez. How are you today?
Buenos días, doctora. Vengo a verla porque siento muchos dolores debajo de las costillas y hasta me duele la espalda.
Have you eaten anything greasy lately?
Bueno, he estado comiendo lo de siempre. Usted sabe, un poco de carne y de vez en cuando pizzas y comidas grasosas. Pero yo comía este tipo de comidas antes de sentir este dolor. Ah, también siento como un ardor en el estómago después de comer. Inclusive hasta cuando tomo agua siento ardor.
Well, the fact that you have been eating the same type of food for a prolonged period of time indicates that you may have reached a limit in tolerating greasy food. Usually, greasy food affects not only the stomach, but also the gallbladder and the digestive system in general. Do you feel like throwing up in the mornings?
Al despertarme siento agruras y ganas de vomitar. Tomo agua y me siguen las agruras, pero se me pasan las ganas de vomitar.
Have you been experiencing these symptoms for over a week?
Me siento así desde el lunes próximo pasado, es decir, ya hacen 10 días que siento estas molestias.
Very well. Let me ask you some questions regarding your previous ailments and conditions you had. First of all, when was the last time you had a physical?
Hace más de 3 años.
Did you have any condition or ailment similar to the one you are experiencing at this time?
Cuando tenía 20 años me tuvieron que operar del apéndice. Me agarró peritonitis y me llevaron a la sala de guardia de urgencia. Casi pierdo la vida. Creo que desde ese momento comencé a tener dificultades con mi digestión. Por un tiempo no sentía agruras, pero ya comenzaron de nuevo. ¿Qué puedo hacer, doctora?
Well, the first thing to do is to identify the problem. We will need to take some pictures of your digestive system and then determine if there is an ulcer or how serious your heartburn is. Before doing that, you will have to take a white liquid. Its taste is rather awful. It tastes like chalk. However, without it, we will not be able to know the exact location of your ailment. Without knowing its location, we won't be able to properly treat your digestive problem. Before we get to it, I need to ask some further questions. Your lab tests showed a high level of cholesterol. You have 295, which is certainly something that needs our attention.
Pero, cuál es el nivel normal?
Between 185 and 195/200 is considered borderline.
Pero, ¿por qué tengo el colesterol tan alto? ¿Será por la comida o será por mis nervios?
Stress may have something to do with it. However, stress will not increase your cholesterol level to that reading. I believe that it is due to a combination of factors. First of all, the diet is indeed a good reason for such a reading. Second, the genetic predisposition to have high level of cholesterol could be a factor. Third, lack of exercise could also be a factor. Do you work out?
No mucho, solo cuando camino a la parada del camión. No salgo a correr o voy a algún club para hacer pesas o ejercicios en general.
Is there anyone in your family who has or had a high cholesterol level?
No sé, doctora, solo sé que mi abuelo murió de un ataque al corazón.
Well, that incident could have been related to high cholesterol levels. At any rate, we need to take an aggressive approach to stop your discomfort and, most important of all, to reduce your cholesterol level. Quite often, the ailment and discomfort you feel is the way used by your body to tell you that something is wrong. In this case, the high level of cholesterol is what is wrong with you. This could be serious, and it can bring some additional problems of a more complicated nature. You must understand that you must reduce your cholesterol level. Do you understand that?
Claro que sí, yo quiero curarme porque tengo mis hijos y no quiero que tengan que sufrir viendo a un padre enfermo y postrado en la cama. Haré lo que usted me indique, doctora.
Well, the first thing is to prescribe you some pills that you will take until your cholesterol level is reduced. You can get them at the pharmacy downstairs. I will ask my secretary to call them so they can have it ready for you as soon as you leave my office. The second thing to do is to follow a strict diet. No fats, no alcohol, no smoking, no fried foods. The nurse will give you a few sheets containing a preferable diet. I believe that they are also written in Spanish. The third thing to do is to determine where your discomfort comes from so that we can treat it. This should not be a problem. However, you need to come back so that we can take some pictures of your stomach lining and determine how to proceed. Did you understand what I just told you, or do you need me to repeat it for you?
Entiendo, doctora. Creo que voy a seguir sus instrucciones al pie de la letra para mejorarme. ¿Cuánto tiempo me va a tomar hasta estar bien nuevamente?
It all depends on how soon you implement these measures. The sooner you do so, the sooner you will get better.
Está bien, doctora. ¿Cuándo tengo que regresar?
Come back in 3 days for the stomach lining imaging. Make sure the nurse gives you the instructions to be followed before coming to the examination. Is that clear?
Muy bien, doctora, así lo haré.
Okay, I will see you on Thursday morning.
Gracias, doctora.
Okay. All right. So this basically ends the practice, and we will be discussing the terminology for, if there is any question, we will be discussing the terminology from this practice after we take our break. Okay? So this ends lecture 8 before the break, and it also ends the live broadcasting that we have now through our website, through our website, interpreting.com. Okay? Thank you.